Fanconi anemia, Fa, is a rare but serious inherited blood disorder that leads to bone marrow failure, increased risk of cancers, and a variety of physical abnormalities. It is part of a group of diseases known as inherited bone marrow failure syndromes. Fa is primarily a genetic condition that affects the body's ability to repair damaged DNA, leading to cell malfunction and death. The disease can affect many systems of the body and often presents in early childhood, though symptoms can vary significantly between individuals. Genetic basis and inheritance. Fanconi anemia is typically inherited in an autosomal recessive pattern, which means that a child must inherit two defective copies of the gene, one from each parent, to develop the disease. Rarely, it can be inherited in an X-linked recessive manner, where the defective gene is located on the X chromosome. To date, researchers have identified more than 20 genes associated with Fa, such as FANCA, FANCC, and FANC, which are involved in the Fa/BRCA DNA repair pathway. Mutations in these genes impair the body's ability to fix damaged DNA, especially in rapidly dividing cells like those in bone marrow. Clinical features. 1. Hematologic abnormalities. The most critical and life-threatening aspect of Fa is bone marrow failure. This occurs when the marrow can no longer produce sufficient blood cells. Patients may develop anemia, low red blood cells, leading to fatigue and pallor. Thrombocytopenia, low platelets, causing easy bruising and bleeding. Leukopenia, low white blood cells, which makes the body more susceptible to infections. These symptoms often appear in early childhood but may also be delayed until adolescence or even adulthood. 2. Physical abnormalities. More than 60% of patients with Fanconi anemia have congenital anomalies. Some of the common physical abnormalities include short stature, abnormal thumbs or forearms, skin pigmentation changes, café au lait spots or hypopigmented areas, microcephaly, small head, renal abnormalities, structural defects in the heart, ears, and gastrointestinal tract. 3. Developmental and neurological issues. Children with Fa may also experience developmental delays, learning difficulties, and hearing loss. However, the intellectual impact varies widely and many individuals have normal cognitive development. Cancer risk. Individuals with Fanconi anemia have a significantly elevated risk of developing cancers. The most common cancers include acute myeloid leukemia, AML, a rapidly progressing cancer of the blood and bone marrow. Squamous cell carcinomas, particularly of the head, neck, esophagus, and anogenital region. Myelodysplastic syndromes, MDS, a group of disorders caused by poorly formed or dysfunctional blood cells. Cancer may occur at a much younger age than in the general population, and Fa patients often do not tolerate standard chemotherapy or radiation well due to their underlying DNA repair defects. Diagnosis. Diagnosis typically involves a combination of clinical evaluation, based on physical anomalies and symptoms. Chromosome breakage test. Cells from a blood sample are exposed to DNA-damaging agents like deoxybutane, DEB, or mitomycin C, MMC. Individuals with Fa show excessive chromosome breakage. Genetic testing, to identify mutations in one of the Fa-associated genes. Prenatal diagnosis is also possible using genetic testing or by analyzing cells from amniotic fluid. Treatment options. There is currently no cure for Fanconi anemia, but several treatments can manage symptoms and prolong life expectancy. 1. Androgens and hematopoietic growth factors. These drugs can stimulate bone marrow to produce more blood cells. However, their effect is often temporary and may have significant side effects. 2. Bone marrow or stem cell transplant. This is the only curative treatment for the hematologic aspect of Fa. A transplant can replace the faulty bone marrow with healthy cells from a compatible donor. However, this treatment carries high risks, including graft versus host disease, GVHD, and increased sensitivity to conditioning regimens. 3. Cancer surveillance. Because of the elevated cancer risk, FA patients require regular screenings and prompt treatment of any suspicious lesions. Prognosis. The life expectancy of individuals with Fanconi anemia has improved over the years due to better supportive care and advances in stem cell transplantation. However, the risk of developing cancer remains a significant concern, and close medical monitoring is essential throughout life. Conclusion. Fanconi anemia is a complex genetic disorder that affects multiple body systems and requires lifelong management. Although rare, it offers crucial insights into DNA repair mechanisms and cancer biology. Early diagnosis, appropriate treatment, and continuous follow-up can greatly improve the quality of life and survival of those affected by this challenging disease.
Thank you for watching. Please subscribe our channel.